No clarity on health care from the White House today. In fact, one would argue even mixed messages. Now, this after President Trump first supported, then criticized within 24 hours, a bipartisan effort to restore Obamacare subsidies. The president, he first supported the bipartisan deal on Monday, then criticized it, as I said, early Tuesday. And with no word from the White House today, no one seems to be entirely sure what the chances are for the deal to actually pass and be signed into law. But Democrats in Congress are still kind of hopeful, including Congresswoman Nita Lowey, Democrat who represents both Westchester and Rockland counties. Well, Andrew spoke to the Congresswoman about health care, Puerto Rico, that messy opioid law we've discussed earlier, and the importance of local elections. They spoke before the president's flip-flop yesterday.
Congresswoman Nita Lowey, some word of potentially positive developments on the health care front with a compromise being worked out in the Senate. I know details are still sketchy, but at least it's nice to have some good news on the health care front.
I am so pleased that Lamar Alexander and Patty Murray really stuck to their guns and continued to work in a bipartisan way, because we know that you had to do something about premiums. Premiums were just, I see it from my health plan, and I am part of the Affordable Care Act plan. So you'd had to do something about premiums, you have to do something about support, and you had to do something in areas where they were losing even one provider. So this is an important beginning, and I hope the bipartisan effort can continue so we can improve it. Doesn't make any sense for people to say, I don't like it, it's no good. They've tried for the last 7 years, the Republicans, to get rid of it, but no one could agree.
And it feels like it's been consistently under attack all year long as we've, the failed efforts in first the House and then the Senate and then the second failed attempt in the Senate. Will we ever be at a place, will you ever feel comfortable like it's safe and secure at this point and we can start worrying about other things, or is this going to have to be something on everybody's radar for years to come?
First of all, the Republicans have been trying to kill Affordable Care Act, Obamacare, whatever you want to call it, for the last 7 years or more. And they couldn't succeed because they couldn't find anything that would do the job more effectively. So I'm hoping that working in a bipartisan way, as I mentioned, address the premium issue, the cost issue, the lack of providers. I think it's important that we work together because health care is a basic right. It's essential, and we can't have it just get out of control.
Let me shift to Puerto Rico. I know you've just returned, or you were recently in Puerto Rico, and you had been there before, so you've seen the before and after. Obviously, we know 85% of the island still without electricity. Things are still terrible there. What did you see in terms of the response and in terms of the federal footprint there and FEMA, and are we doing, because that's really the question that a lot of people have, other than how can we keep people safe and how can we help save lives. But has this response been as fully throated as it has been in Texas or in Florida or elsewhere?
First of all, I had been to Puerto Rico before, but I had never seen it in a helicopter, and we were flying low over the whole country. It was invaluable because I've been to the beaches. I've been there with a family on vacation, but to see the mountain areas, the valleys, all the roads were washed out. The grid was not functioning. The bridges were not functioning. So people who live in the mountains or in the valleys away from the main center, the tale still hasn't been told. We don't really know how many lives have been lost. The number, I'm told, is 49. Some people say it could be several hundred. There have been stories about old women, elderly, still sleeping on a wet mattress because they don't have any roofs over their head. So I was impressed with the commitment and the energy of the FEMA people. One of them, who was in our plane, or our helicopter rather, was telling me that he hadn't slept for 2 nights because they're working around the clock. So there's tremendous commitment, tremendous energy. Whether they came later than they should, someone's going to be doing a whole analysis, and I want the facts. We know that the U.S. Comfort came providing help, providing beds, providing medical services. There's so much to be done. The grid isn't functioning. They really need a new grid. So I'm hoping that there could be a positive partnership with the government of Puerto Rico so we can be doing the right thing and getting them back on track. But we also have to know upwards of 25,000 people have left and have gone to New York, Florida, because frankly, if you had relatives here, you wanted out if you can get on a plane.
You know, and you're there in a capacity as a powerful member of the House, but it's obviously not the area that you represent. If you saw what you saw in Puerto Rico happening in Piermont or happening in Tarrytown or somewhere in the 17th Congressional District, I can only imagine, you know, what your reaction would be and you know, what do you have any idea what your reaction might be? We experienced something like this during Sandy, but nowhere to this level.
Well, first of all, this came at a time when we were appropriating money for wildfires, for hurricane disasters in Texas and Florida, many places in the States. And I'm happy that we were able to support and vote for $36.5 billion in money, and there'll be more coming. But I have large numbers of people in my community, both Westchester and Rockland, who have relatives in Puerto Rico. And I keep reminding anybody who complains about the money that these people in Puerto Rico are citizens of the United States of America, and we have an obligation to work with them. And I'm hoping there'll be a real partnership between the government and the government of Puerto Rico and the government of the United States in trying to build more strongly. The grid never was functioning correctly.
Want to shift to the DEA, which is and the report from 60 Minutes about the efforts of Congressman Tom Marino to pass a bill that made it harder for the DEA to crack down on the opioid epidemic. And Marino was nominated for a post, and he's walking away from that. My question, I think the question a lot of people have is, in 2017 or 2016, we're still passing laws where we don't fully know what the impact is, and this was signed into law by President Obama, and the unintended consequences didn't become known until later. How does that happen?
Well, first of all, I have to say that information is shocking because there's been bipartisan support for dealing with the opioid epidemic. In fact, Chairman Hal Rogers of Kentucky has been one of the leaders. This isn't a Democrat or Republican issue. As I travel around my district, it's very clear to me that there is an epidemic and we've got to deal with it. So sometimes a law will get passed and maybe people don't have, even informed members of Congress may not understand the full implication. But the real question is, how does the administration appoint a guy like Tom Marino who had his private interest in this issue? So I'm hoping we can get someone who's really responsible. Some names have been mentioned, and continue the efforts. There really is a focus on appropriations. We've been appropriating money for all kinds of community planning.
Language from lobbyists gets into bills that are passed by both parties, and that's still an area of concern and may have played a role in all this.
But not all that language is evil and inappropriate.
Right. Before I let you go, I know we're just about out of time, but elections are less than a month away. I know you're not on the ballot. It's not a congressional election season, but very quickly, the importance of people voting and turning out in local elections. What would you tell them? And you know, people don't turn out nearly in the same numbers that they do in even number of years.
I am so delighted, Andrew, that you brought that up because this is my passion. I'll go into local diners, a whole lot of stores on a strip where you have young people working and sometimes middle-aged work, and they'll say, "Oh, hello, who are you?" They don't even know who their congresswoman is. It's essential to vote. So who's ever watching this, get out there and vote. You are blessed to be a citizen of the United States of America, and whether it's for president or Congress or anything, any office, you've got to get out and vote. And this race for county executive is critical. So get out and vote. Vote your mind, study the issues, but make sure your voice is heard.
I always know when you're fully enthused about a topic because the table winds up suffering the consequence.
Well, I think it's so important, and I worry about not enough people getting out and voting.
Congresswoman Nita Lowey, as always, thank you for a few minutes. Really appreciate it.
Pleasure to be with you.
Coming up next, we'll take a look at some local Valley headlines, so please stay with us.